do a quick round of introductions for everybody in the room, and then I'll hand it over to you.
Great. Yes.
Oh, we're live.
We just.
Okay, thank you. Welcome to the General Assembly Progressive Caucus. It is Tuesday, January 20th, and today we'll be focusing on artificial intelligence. We're going to start off with a quick round of introductions for everyone who's in the room and on Zoom. And then I'll hand it over to Brian, Representative Cheetah, so that he can facilitate. And then we have a hard stop at 12:45 so that we can get to the governor's budget address. I'll start. I'm Representative Kate Logan. I represent the Chittenden 16th District in Burlington, and we'll go to you.
Hi, I'm Caroline Gelly. I'm a social work intern at UVM.
Courtney Rickard, I'm with the House Clerk Office. I'm Representative Chloe Tomlinson. I represent
my name is Aiden Carpenter. I work with Dax Brent for the consultant.
I'm Nicholas Duncan. I represent Wilmington, Readingham, and Halifax in the House. Hi, Lisa Gerlach. I am with AFT Vermont Healthcare and Higher Education.
Sam Hartman, I'm with Action Services.
Senator Tanya Bihovsky. I represent the Chittenden Central District, which is Burlington, most of Burlington, all of Winooski, most of Essex, and a little bit of Colchester.
And I'm Representative Esme Cole of Hartford. Executive Director of the Progressive Party, Tyler Thomas.
Ryan Chino, State Representative from Chittenden 15, which is Burlington, representing part of the Old North End and most of the, not all of the East District.
Go ahead, Brian.
So we're gathered here today to talk about the emergence of technology known as artificial intelligence. Artificial intelligence technology permeates our way of life on Earth. It's surrounding us and rising like water. And if we don't stay aware of ways to maximize its benefits and mitigate its risks, humanity threatens to drown. And so we have here today some guests who are going to be talking about their concerns about artificial intelligence and hopefully also potential ways that we can maximize the benefits. We have guests coming from at least 2 organizations, and we're trying to fit everyone in before the governor's budget speech. So we'll start with our first guest, who is here from AFT Vermont. If you could just introduce yourself, what part of AFT Vermont, what sort of shop, so to speak, you come from with AFT, and just jump right in to what you have to say, if there's anything you want to start with. And then our other guest is going to have a presentation when he arrives. So it looks like Sophia's your name. I can see my glasses off. Would you be okay jumping right in now, Sophia?
Yeah, that would be great. Thank you. So yes, my name is Sophia Simpkins. I'm the VP of Political Education for the VFH&P. So that is the Vermont Federation of Nurses and Health Professionals. So we include nurses and tech professionals at UVMC, so the hospital in Burlington, but it also is outpatient in like satellite offices in Chittenden County, I think is mostly where we are. Yes, so what I would like to discuss today is trying to include parts about like nursing and AI. I think we're concerned about multiple things with AI. I work in outpatient triage nursing. So there's a concern of AI being used to potentially replace us in the future. There's nothing the hospital is talking about now, but with way things are moving across the country, I don't think that's necessarily something that should be rolled out. Inpatient, there's already products that are available to put AI like and cameras and monitors and sensors like in hospital rooms to like monitor patients, but also like the nurses who are providing care and like a big brother-esque fashion. And I think it seems to be my general feeling is AI when it comes to physicians, so I'm sure they have concerns about obviously like their services being replaced as well. A lot of it's being used to help them, like to help write their notes, to help it make it easier for them to do their work so they can see more patients and be more efficient. But it seems more for nursing that it's to replace or to monitor us for like compliance when AI could be used more to assist us with our documentation. And there are some talks like inpatient, like how AI could be used for those things, but there's a lot of talks about like we're going to use cameras to monitor how often you're doing this task in a timely fashion. Otherwise, you're going to get dinged. So I think that's the concern from nursing that I've seen, but I'm happy to answer like any questions as well. But I certainly don't want I think there's some like protection around the term of being like called a nurse. Like, do we want AI chatbots being like, "Hi, I'm your friendly triage nurse to triage your health complaints," and that's not the same as like having an actual nurse speak to you and take care of you. But yeah, I'm happy to answer any questions.
A couple things.
Yes, maybe you could just repeat who you are.
Yes, so I'm Lisa Gerlach. I work for AFT Vermont as our local organizer. So echoing everything Sophia said, it sounds like over the summer there were some vendors, like a vendor fair at EVMMC, where they had some vendors that, when looking into them, had some concerning things, including, like Sophia mentioned, monitoring healthcare workers to see how often they wash their hands, how often they do this task, how often they do that task. And we're just concerned about sort of that Big Brother-esque aspect of it. And we've also seen some vendors that talk about reducing nursing FTEs, so nursing hours, so replacing nursing tasks or nursing roles with AI. I think that our primary concern is making sure that patient-facing roles are not replaced by AI. So I know Oregon had some legislation last year about keeping the title of nurse out of anything that's not a human, which I think is a really good step to start that. And then one other thing I want to mention, so there's CPSAs, which is Clinical Patient Safety Associates, I believe is what that stands for. That role in the hospital is support staff. Their job is to constantly monitor high-risk patients. So that's either being right outside the room, or for lower medium risk patients, there's a monitor room in the hospital where they can see people and press a button to alert nurses if something is wrong. And there's talk about patient monitoring being replaced by AI, and that's concerning because part of that role is not just to watch, but to be able to step in if something's happened, if somebody becomes a risk to themselves or to others. So it's not just keeping an eye, alerting somebody else, though that is some of it, but having an actual human there to keep an eye on high-risk patients is something that we don't want to be taken over by artificial intelligence. So those are just a couple of concerns that we haven't seen any of these things implemented yet, but that they were bringing in vendors that do these things is concerning, and we just want to have that conversation started and sort of preemptively maybe address some of these things.
Thank you. So because we're on a tight crunch, instead of asking questions maybe now, we can let our next guest go, and then the remaining time have a discussion where we combine what we've learned. We've heard so far concerns about patients' rights and workers' rights, I would say, about the use of AI in healthcare settings. Our next guest is going to talk about an additional component of human rights, the human rights, I think, aspects, and how do we maximize benefits of use, maximize the benefits and mitigate the risks of use of neurotechnology as it's emerging from the Neuro Rights Foundation. So Sean, maybe you could quickly introduce yourself, and then you said you had a slideshow. Courtney, are we able to share? So we're able to give you the ability to share your slides yourself. So then we'll give you about how much time do you think you need for your presentation?
I can be quick, maybe 10 minutes. Would that be too much?
I think 10 minutes is perfect, because then if you do around 10 minutes, we have about 15 minutes to discuss. So about what you all, both of you presented, and also if any of the other invited guests do show up, they can have a minute. So So you can jump right in we'll let you take it away.
All right. Yeah. Well, thank you so much, Representative. And it's nice to meet you all virtually. I'm Sean Pazowski, current medical director of the Neuro Rights Foundation. We're a human rights and technology foundation based in New York and DC. I've been doing some work around the country related to this very important issue of neurological rights. So we'll just launch right in here. And can you see?
Mm-hmm.
Is that appearing on the screen? Okay, great. Yeah, so just kind of take a broad overview, kind of some of the background, and then maybe dive into some of the specifics. Again, I'll try to be pretty quick. But just to kind of dive in, so talking about neural data privacy, so where did this kind of come from? So the issue basically was originated about 10 years ago. There was a funding initiative through the NIH called the Brain Initiative, signed by President Obama in 2013. And this was really kind of what jump-started this whole industry of neurotechnology. BRAIN stands for Brain Research through Advancing Innovative Neurotechnologies. And this really sparked this whole movement and really a coming revolution of ways for patients and consumers to interface their brains with technology. And so what came out of that, just like in all technological revolutions, you have ethical issues. So like with nuclear technology, you can power a city, you can do destructive things. Genetic technology, similar. You can tell things about people's health, but you can also do weird things like clone people and stuff like that. So neurotechnology is really, we view as the next coming technological revolution, no different from prior technological revolutions in that there are certain ethical issues that need to be addressed in order for the benefits of that technology to be enjoyed. And so about 4 years after the Brain Initiative was signed into law, there was a group at Columbia University called the Morningside Group who got together and identified at that time 4 ethical key principles for neurotechnology, things that need to be addressed, and one of which is very embedded in this bill. So I'm very happy and just so excited to be here to talk to you about this because this is really important stuff. And that first neuro right is mental privacy. So patients and consumers, we believe, should have absolute control and access and a right to say what happens to the information coming from their brains. You can see the additional neural rights. We're not against neurotechnology by any means, by any stretch of the imagination. We think everyone should have fair access to the benefits of neurotechnology, or what we call mental augmentation. We don't think anybody should be biased against, and that people should preserve their identity and free will. But the one that really applies to this bill, we feel, is this right to mental privacy. So you can see President Obama. And so really the motivations behind the BRAIN Initiative were scientific advancement, medical progress, and economic growth. We're up to about $5 billion carried through by all administrations. This is not a partisan issue. All administrations have carried forward the BRAIN Initiative. And so what it's really done, it's allowed us to dig deeper into really the mystery and the complexity of the human brain, generated amazing scientific advancements as well as clinical advancements. You can see this BRAIN Initiative sparked a movement across the globe. Europe, China, Australia all got involved with their own BRAIN Initiative, including Japan. And so what you can see is that this is not just a cultural thing, but really, an economic and cultural thing that's really growing exponentially. So right now, today, the total value of the neurotechnology investment in industry and market, somewhere around 15 to $17 billion. But projected to grow by 10 to 13% over the next 7 to 10 years, up to $53 billion. And so you can really see that we're at a critical point where this stuff is just poised to take off. And so it's really important that we act now to get ahead of this in order to provide the protections that patients and consumers deserve. You can see here just the consumer-facing neurotechnology market. It's very important to make this distinction, especially for this bill, because I'm a clinical neurologist. I'm an MD. I practice in the hospital. I do research, including with some of these devices, which is what got me interested in this issue. But really, a lot of these devices are facing consumers and not regulated by the same protections, for example, that we enjoy with the federal privacy standards with things like HIPAA. And so you can see here many technology products not regulated as medical devices, which is why we need this legislation. So you can see here, I'm not sure if you can see me on the screen at the moment, but I do have a couple of these devices to demo, just to kind of show you what they look like. Can you see me at the moment?
We see you as a tiny little square in the corner.
Okay. Okay. Well, you can maybe see here, if I can get it in the camera. I actually just got this in the mail a couple days ago. You can see this wristband on the screen here. This is what Meta just released as a device for consumers to control their augmented or virtual reality glasses with. This is called the Orion wristband, and what it does, it takes neural data from your wrist here. I won't put it on just for time's sake, but I've been testing it out the past couple days, and it works really well. And it can actually read what is going on at the level of your wrist in order to control your device. I think everyone's familiar with AirPods at this point. You can see Apple has a patent on a consumer-facing EEG AirPod that we think is set to launch here in the next couple of years. And so you can see this is just poised for exponential growth, and it's actually already happening. Um, just to kind of give a broad overview of what's already happened. So in 2021, Chile became the first country to pass a constitutional amendment to protect brain data. You can see there was a state in Brazil that followed in 2023. There are currently bills kind of spreading all over South America in these countries, as well as the Spanish state of Cantabria. So really gaining some momentum in South America. There's effort at the UN right now. Things like the Human Rights Council, the Rapporteur on Privacy, and UNESCO have all taken up this issue and have currently developed documents and things that are highlighting the importance of neural data. Last year, Colorado and California became the first states in the US to protect neural data as part of these broader privacy acts. The Colorado Privacy Act and the California Privacy Act, followed by Montana and Connecticut last year. But what you're doing or potentially doing in Vermont is very unique and would be kind of the first standalone bill on this. So very, very important and could really garner a lot of attention. Um, the Neural Rights Foundation released a report tied to the Colorado bill last year, looking at the privacy practices of all of these neurotechnology companies, and found that, as you would imagine, that there were major gaps in terms of the things that they were able and could do with the data, could sell it, didn't really give consumers a real right to delete or control their brain data. So this is really where the regulatory gap comes in and the real risk to patients and consumers. I'll just kind of skip ahead here. So Vermont is part of a growing a movement really across the country. You can see you're not alone in terms of states considering these bills, but what makes you unique is that this would be the first standalone bill in the country to really protect neural data. And I really like what you're doing in terms of integrating it into something that's health focused, because it really highlights the peril here for patients. And then tying it in with AI is just could be so impactful. I'll just kind of skip ahead here. There is some traction at the federal level right now as well. Chuck Schumer, Senator Markey, and Cantwell introduced what they're calling the MIND Act, or the Management of Individuals Neural Data Act. But as we all know, these days in Washington, things are really not the most reliable in terms of things getting done. And so continuing efforts at the state level is just so important. You do have the backing of the American Medical Association. Just last June, the American Medical Association passed a policy really defining what neural data is and what it is not, which is key here. I'll just kind of skip ahead here. I don't want to run over too much. And so all of this is kind of broad overview context and why we should act now. But I do just kind of want to drill down just for a minute, and I'm not sure how close I am to the 10-minute mark, but I'll be quick here. So really, what is neural data? What's up?
You have about 5 more minutes, so you don't have to rush.
Okay. Okay. Yeah. Yeah. That's good. Because I really want this to be clear, just so it's, a lot of this, people are familiar with what neurotechnology and neural data is, but maybe we can just talk for a second about what is the real risk here and how it applies to the bill and mental health and all of these things. So the brain is an electrical organ, or runs on electricity, and those signals can be captured by the use of neurotechnology, kind of oscillating waves, and we call that electroencephalography, or EEG. What I just showed you in the wristband is what we call electromyography, or just kind of generally electrical signals taken from the muscles in the wrist. And so these are really the two types of neurotechnology. About 90% of these devices, and I have a few more here to demo, Sorry if it's not. Um,
They
but
look like,
Yeah, these are headphones that can actually collect brain waves. I use these almost every morning when I write my clinic notes, just to kind of get a sense of, my brain waves. But you can see at the level of the consumer market, you can order these right now, and they can tell you things about your focus. They can tell you things about your cognitive speed. They can tell you things about how prepared you are for your day, all based on these brain waves. And so you can see this is all becoming stuff you can just order off the internet, have in your home, next week, and be collecting these two types of neural data, electroencephalography and electromyography. There are other types of neural data, but these are kind of the two most common. I'll show you another set here. These are earbuds that you can get off the internet from a company called Emotive. And these can also collect brain waves, tell you things about your mood, about your focus, really get deeper into the consumer's experience than ever before. And so, what's the peril here? So, we're talking a lot about mental health and AI. Well, believe it or not, mental health is poised for a revolution. Things like anxiety, depression, obsessive compulsive disorder, schizophrenia, you name it, sleep disorders. In the past, you had to come into the clinic or the hospital in order to have one of these tests done, and you'd have it in one isolated 30 or 45-minute setting. Now you can just put these headphones on or these earbuds. I also have a headband here. These are sensors that collect brain waves. You can see it's just so many different options now to collect data about your mental health disorders, and then tell things longitudinally over time, day by day. I mean, that's how we're able to diagnose these conditions by neural data, anxiety, depression, OCD, schizophrenia, you name it. It's a revolution about to happen. And so here's a little bit more about what neural data is not and how it's uniquely sensitive. So we're talking about those brain waves and those signals from the wrist, not so much things like heart rate, eye tracking, voice recognition, facial recognition. It's just really important to make that distinction. Here's just a little bit more about just kind of the federal stuff. And I'll kind of stop there. But I want to leave it on this slide here because this cuts really to the heart of what you're potentially doing in your bill, which is that patients and consumers deserve a right to control what's coming out of their brains into these devices, going into the cloud, being analyzed by companies, and what could potentially be done with that data. So just to name a few of the risks, manipulation is a big one. We already know that this is already going on in terms of, the algorithm, and when we use social media and all of our data is already out there online and being used and being fed into these algorithms, which are being used to kind of try to manipulate us. Well, what would happen if the company didn't even have to think about essentially what you thought about what you were looking at? Not only do they know what you're looking at, but they know how interested you are, how focused you are, how you're interpreting that information, all based on this neurotechnology. So we really believe that consumers deserve a right to that data. And then as far as the mental health conditions themselves, that could be sold to insurance companies, that could be used to discriminate against people, that could be used to profile people, all these things that are just kind of like there's no regulation right now. There's no protection for this data out there right now. And so hopefully I'll stop there, but hopefully that's a good overview, and happy to answer any questions about, this neural data and why it deserves protection.
thank you. And if you could stop sharing your screen, then we can open this up for questions. Before we open it up, I'll just say that what we're hearing is that we are in the midst of a revolution in healthcare, and part of it is neurotechnology. And if we have safeguards in place and we make sure there's equitable access to these technologies, that we may be able to help people cure or treat, at the very least, health conditions in a way that humans have not yet done. And if we don't do it right, we may open ourselves up to a level of manipulation and control that humanity has never seen through these technologies. And so Vermont did have a neural data piece of the data protection bill. It was not as comprehensive as the current AI healthcare bill that I sent out to everyone. Well, I didn't send it out to everyone in the legislature yet. So I should send it out to everyone this week, but because I have a few AI bills that I'm going to send out as a package. But this one that Sean's talking about, it's unique in that it's laser focused on neural rights. And so if there's another data protection bill that gets vetoed, like the governor has already signaled he'll do, Perhaps this one he won't, because of the pivotal protections it provides, without getting in the way of progress. And so I just wanted to frame it that way, that, we have an opportunity here in Vermont to take a step forward and be a leader in the country in how do we respect human rights while not getting in the way of our evolution as a species. So that being said, before Sean, we heard from a healthcare worker about on the ground concerns. Does anyone have any questions for Sean or Sophia? I believe that
Sophia had to leave, I can also give her email address.
Okay. Or you could perhaps answer it if you know, right?
I do.
Yes, can you say who you are again for anyone watching, or for Sean?
Yes, indeed. Emily Harris Duncan. I represent Livingston Whitingham in Halifax in the House. I am curious to know about any conversations about telehealth and AI. I know that there is maybe some talk about the ability to video your telehealth appointments. So I was just kind of curious if that's
Well, the House just passed the bill.
yes.
Yeah, so did you want to say something about it? Because I can,
No,
based
but
on.
then I can give a Senate update as well.
Okay, yeah, so then maybe I'll start with, in the House, what we did is we allowed video recording of telehealth, which we already allow for live healthcare. So it's just extending it, but what we learned as part of that discussion is that the healthcare records in multiple designated agencies and at UVM Medical Center, or UVM Health as it's now called, are using these recordings to create medical records that the doctors then review and sign. So we are already seeing in Vermont, in our healthcare system, use of AI to generate text of recordings that are audio. They're not video yet. They may also do it with video soon. And we don't have much safeguards in place about this. And the benefits are, what we heard from staff, is it's making them be more present with the patient and not have to write as much. And if the patient has to consent to it, so it's not like the patients know it's happening when it does happen. And potential coming benefits are that these systems actually have the capability to integrate information from a person's entire medical record, including their genetics and neural data eventually. So anything in the medical record to warn the doctor or healthcare provider that they missed something. And that could be huge, that if the medical record says, hey, wait a minute, you didn't ask the patient this, and then they ask the patient it. So there's all these benefits. The risks are no one is really clear about how the data is being used by the vendors. And one of the vendors, Elios, is connected to Zionist companies in Israel that track the Palestinian population. So we don't know how they're using their data collection here to further their interests there. And no one is willing to talk about that for long.
That was my question.
Okay.
I'm aware that we didn't have that legislation, but that's something that as we continue to work, I think the various integrations of AI capabilities into the ability to, we know about deepfakes.
Do you want to give a Senate update?
Yeah, on the Senate side, I don't know that it's been released or has gotten a bill number yet, but Senator Gillick and I worked on a bill to actually more clearly define what informed consent means for this type of AI usage and put some parameters around how that information and data can be used. And then sort of adjacent to that, we've also introduced and walked through a bill in Senate Health and Welfare that would actually prohibit the provision of therapy using AI. So the sort of bots that provide therapeutic services. So those are two things in this arena that we're working to try and rein in potentially damaging behavior while, again, allowing for the places that this would be useful. So those are two things happening on the Senate side.
But just to Sean, did you have any, I know it was a little outside of the scope of your presentation, but do you have anything to add about the telehealth piece?
Yeah, I mean, all this data, is going to be pooled together, presumably, in some way. And so as these neural data collection devices kind of, integrate with just society more generally, I think there are going to be more uses of neural data in terms of the medical record. And I will say that there is no neurotechnology revolution without an AI revolution. Like, as a clinician, I can look and tell if somebody's having a seizure, maybe their brain's not working up, properly, or in a couple different ways. But with AI, that's how you can tell all these diagnoses with anxiety, depression, OCD, schizophrenia. And so I do see it all kind of coming together in some way, shape, or form. And that's why I'm so excited for this bill, because it really cuts to the heart of the issue, looking at patient data, mental health, and AI, with neural data all together. It's a very exciting combination.
I saw your.
As soon as we start talking about patient data, it strikes me that I'm just curious about how neural privacy relates to HIPAA. Just don't know much about.
Right. So that's a great question, and that really also cuts to the heart of the issue. So it's not that anybody, it's not that anybody intentionally left out neural data when we were talking about, things in HIPAA or these kind of privacy acts around the country. It's just such a new concept and technology. I mean, a lot of these companies have only been around for 10 years, and that exponential growth is just poised to take off. And so it's not that anybody was leaving out this kind of consumer grade neural data, but that is the regulatory loophole right there, is that this data is not there because they're marketed as wellness devices. I think is kind of the short answer to that question, is that they fall out of, the FDA doesn't have a category of data for consumer neural data. If they're in a hospital setting, sure, HIPAA applies, but these companies are marketed as wellness devices, and that allows them to kind of escape some of the federal privacy standards.
And it means that in a healthcare setting, if we integrate the use of these devices, then that information would become, if it becomes part of a health record, would be covered by HIPAA. But when these devices are used outside of a healthcare setting by people, there's no protection. And I think that's the concern, is people may, without some guidelines, people may think they're safe when they're not. So I saw a hand.
Yeah, I understand the goal of the bill, but could you speak a little bit more to like what specifically the bill does to accomplish?
The healthcare one that I sent out?
The neural rights.
Yeah, so it without looking, I'm gonna try to summarize it, and then I'm gonna send out later today a package of AI bills, which this will be a part of with this, and I'm gonna use AI to make the description, like make a summary, which is always fun, and then I review it, but I'm gonna do that very transparently, because I think it's fun. So what this does is it enshrines in statute a code of rights, of neurological rights. Which I did receive some feedback from NeuroRights about the language in retrospect, that the committee might want to adjust to align with international standards and national standards. But that issue aside, we would create a code of rights. It would be a chapter of Vermont law called Neurological Rights. Then it would go on to add into Title 18, the healthcare chapter, the healthcare section of Vermont statutes, protection around the sharing of the data, protection around the manipulation of people's personalities and behavior without their consent. And the reason we say without their consent is that if someone has a disorder that's affecting their personality and neurotechnology is going to fix that, then they can consent to the technology fixing it. But like what we don't want is neurotechnological interventions that people aren't consenting to, that someone else is saying, we're gonna make everyone really calm. We're gonna make everyone really angry right now, that kind of thing. So it would make it that you have to consent for any kind of manipulation of your personality, of your thoughts, behaviors. Then it also adds in some protections around AI being used in utilization review, which is like pre-authorizations and like the finance piece. And then it adds in protections about mental health and chatbots and generative AI, saying that if you're interacting with an AI, it has to be disclosed to you by the healthcare provider. Those are some of the things the bill is.
Yeah, also just if it's amending the healthcare statute, then does that address the concern about consumer products that are considered to be wellness? And also I wonder what consent looks like in this case. Like, I mean, all of us have gotten a new product and checked the terms of use, and it's like 300 pages of technical jargon. I mean, what does it mean to consent to?
Yeah. Yeah, so it still runs the risk that for wellness products and the data protection in general, and Representative Karis Duncan's on commerce, so maybe you could talk a little bit about that angle. That's always gonna be an issue, but the neural rights would apply even outside of healthcare settings.
Okay.
Yeah, if we add it to healthcare law, because it's a healthcare right, kind of like saying you have a right to choose, or what you put in your body or something. Or kind of how like we have in the Constitution, we have something about reproductive health, but it doesn't prescribe what setting. So it doesn't have to be a healthcare setting to get reproductive products, for example. So do you want to say more though about this, if you feel comfortable, about the issue of how would we address companies giving you a 300-page form to use it that's not clear? Because that's out.
So that comes into, well, consumer usability. Like the products, when we put out regulations, they also have to be demonstrably usable for the consumer. I do think we've been talking about need to maybe go back and look at we're looking at like the opt out for any website. Is that effective? Do we need to tweak it? But there is an outside expectation that consumers are going to sit there and spend their time reading 300 pages in order to cover their butts legally. So, and that was a lot of what came up with the opt out. So we're still kind of looking at what that framework could look like, especially in relationship to the Delete Act or the legislation that we're doing that would be like the Delete Act. But it's not very. Yes, it has to be user friendly for sure.
It's a legit concern that the committee should hear more about, though.
Absolutely.
I saw your hand before we go.
Yeah, I realize that I have a whole list of questions that we may not have time for. But I think just putting on people's radars, like I'd love to hear more about AI prior auths, because I think we've heard about a particular insurance company using that to deny coverage quite significantly. I also want to bring to people's attention S23, which is about the use of synthetic media and AI in elections. And then of course, I think we should be talking about AI in policing and the environmental impact of AI as we're sort of diving down this pathway, but I recognize in 1 minute we're not going to talk about all of those things.
Well, what I'm also hearing is topics for like future caucuses. We could focus at AI in other sectors. Since today the focus was healthcare. So thank you for coming, Sean. Our governor's giving his budget address, which is why we're ending 12:45. But your presentation was very informative and helpful. I'm hoping that we can get you into the healthcare committee once the bill is introduced. So hopefully with more legislators on board, we can maybe, ask leadership to make sure that the issue is given some attention. The healthcare committee we are talking about taking up AI in healthcare as a topic. So the question will be, how far will we go with that? Is it going to be something like simple, like restricting just mental health chatbots, or is it going to be more comprehensive? And just, I guess, let's keep the fire alive around this, and we'll come back to the issue. But that being said, it's 12:45, so thank you very much, and I'll be in touch with you. Thank you for your suggestions for changes as well.
Yeah, thank you so much. And we're happy to support, however, and just again, commend you on this effort. Vermont really has the chance to lead the nation in this. So just so